Salam will present a case. Do we still see COVID-19 uveitis? Do we? Please, Dr. Salam.
مساء الخير. Do we still see COVID-19? Since we're at 2025, I started preparing my lecture by asking ChatGPT, do we still see COVID-19? And then I added another question. Do we still see COVID-19 related uveitis? The answers and what we've seen in our clinics are quite interesting. Actually, more than 60 peer-reviewed articles emphasized on the context of COVID-19 vaccination and large-scale cohort studies on the uveitis after COVID-19 infections, indicating that still it's rare, but still the phenomena is recognized and increasingly documented. Severe acute respiratory syndrome, we've all heard about this term 5 years ago. This case series was published in June 2021. I'll be presenting and reporting 3 cases of COVID-19. These cases have not been reported previously, and our second case was a novel publication about intermediate uveitis post-COVID. We stressed on the importance of urgent ophthalmic assessment of COVID-19 patient complaining of any eye symptoms. Our first case was a 19-year-old male patient with no significant past medical history, wearing glasses for myopia. Presented to our hospital complaining of both eye redness and blurred vision of 1 month duration following recovery from his COVID-19. The patient tested positive by PCR. He developed fever, cough, headache, joint pain, and skin rash. 1 month later, he developed pneumonia and he was treated for that. 5 weeks post-positive PCR, he started complaining of blurred vision, redness, and pain, which usually we see 4 to 6 weeks post-COVID. At his initial examination in January, his best-corrected visual acuity was 618 in the right and 660 in his left eye. His right eye conjunctiva showed hyperemia, corneal edema, KPs, and AC cells. The left eye showed more aggressive behavior with AC hypopyon, with normal fundus examination. He was given the diagnosis of bilateral anterior uveitis and was given topical and systemic treatment. On follow-up, after a few weeks, he improved to 612 in the right, 615 in the left, and 6 months after, he had total recovery with 6/6 vision in his both eyes. He was a medical student during COVID-19 under so much stress. Our second case, the interesting with the novel publication, a 20-year-old male patient, no significant past medical history. He was wearing glasses for myopia, presented on January 24th, 21, complaining of both eye blurred vision and pain of 6 weeks duration, with no history of joint pain, oral or genital ulcers, or even skin rashes. His previous medical history was significant for symptoms of fever, cough, headache. All started in November, 2 months prior to his presentation. He didn't seek any medical assistance, and neither PCR was done during COVID. His eye examination showed best-corrected visual acuity of 618 in both eyes. His slit lamp examination showed white anterior segment. His fundus examination, we can see in the left eye, we can see the vascular sheathing indicating vasculitis. And in the right eye, we can see the web-like vitreous veils indicating intermediate uveitis. And here I also asked ChatGPT, do we have any textbook covering a chapter of COVID-19? Can I?
Yes.
And the answer was no. No ophthalmic or ocular book is talking about COVID till now, even after 5 years of COVID. But I found one pathology book of Yanov from the States covering the intermediate uveitis, and I found that they used our image, which was published in 2021 in the book. So we need to emphasize on this as uveitis doctors in the ocular pathology books. The case was investigated for all infectious and inflammatory causes before giving the diagnosis of COVID. As the patient presented 2 months after his sickness, he had a positive COVID-19 serology IgG titers. And after doing all the examination, it was all negative. We gave him the diagnosis of COVID uveitis post-COVID-19. Our third case, I will not be presenting. You can go to the link and read the publication. But to the best of our knowledge, that was the first clinical report of bilateral intermediate and posterior uveitis. It's well known that SARS-CoV-2 induces conjunctivitis. And however, a positive IgG test alone does not mean the patient is actively ill, no longer contagious. The CDC recommends doing IgG and IgM antibody testing. Conjunctiva is considered as an important portal of entry of respiratory viruses. Conjunctival secretions may contain virus and spread viral infection. However, ACE2 expression in ocular surface is much lower than that in the lungs and kidney tissue, but the ability of SARS-CoV spike protein to bind with conjunctival ACE2 is much lower than that of the lung. We presented ocular involvement in 3 cases of post-COVID-19. All physicians should keep in mind the possibility of uveitis and differential diagnosis when dealing with patients who had previous viral prodromal symptoms up to few weeks prior to presenting with uveitis. Thank you.
Thank you. That's great to have some relations now to still to COVID to these times. But I remember that at the era of COVID, there is a lot of cases were being reported, including vasculitis, including neuroretinitis at that times with some vascular occlusions, but might be that time because of factorial risk factor of the patient who is admitted in the ICU and being in a lot of respiratory therapies, but now we have some intermediate uveitis. My opinion that even though by the time being after the vaccines of the COVID, if post vaccinations we have multiple cases of diversity, like multifocal choroiditis, sometimes we have vasculitis, but we cannot make the relation associations based on the but your cases were documented and confirmed by the serology that the IgG is positive. So anyone of the panelists can make some comments about this? Dr. Ahmed?
Yes. Yeah, thank you so much. We looked actually interestingly recently in there's an entity called long COVID. Are you familiar with this entity, long COVID?
Yes.
Which is like a group of symptoms that happen to patients who had COVID.
COVID syndrome.
Yes, who had COVID syndrome, exactly. And we looked at whether if you had long COVID and you had the vaccination, whether that increased your uveitis or decreased uveitis. And we found that if you actually have long COVID without the vaccination, your risk of uveitis is higher. If you get the vaccination, your risk of uveitis goes down. So maybe actually vaccination, there's a bit of protection against uveitis in patients with long COVID. So I think it's so complex. And as Dr. Hassan just mentioned, it's hard to make a causal relationship. I think we can say there is associations, but benefits of the vaccination may still outweigh the risk of uveitis, if there's any.
Actually, I joined two multi-centered studies regarding COVID vaccination in adults and pediatrics. And also, I put the link of the multinational study of post-COVID in adults. Till yesterday, we had 88 citations. But we did found that because we have evidence of vaccine, we're more supported to say that this vaccine caused this presentation other than seeing that a COVID infection or other virus that had the patient and he had developed uveitis. But what we've noticed that patients after COVID infection waited for 4 to 6 weeks to develop eye symptoms. But in patients who were vaccinated, only 2 to 3 weeks. And they presented because of our unregulated autoimmune responses, which happens after the vaccine. They presented much earlier.
Thank you so much.
You're welcome.
Yeah.